Why did you get involved in the NHS? That's the only...
Gordon Brown rang me up one day and asked me to come to number 10 Downing Street, and he said he had an idea that he wanted to keep the NHS free forever.
Yes.
But he wanted it to be run better.
Right.
And so his idea was, let's break the NHS up into smaller units where people can say, I can run that smaller unit better than anybody else.
The NHS is the most cost-effective health service in the world. Breaking it up and introducing market bureaucracy has pushed up the cost of administration, diverting an extra £10 billion away from patient care. Carving up the NHS into smaller bite-sized units is the polar opposite of what commercial companies do to improve efficiency. To maximise profit and efficiency, they use economies of scale and consolidation, not fragmentation. Staff are the biggest cost in healthcare, so more profit means fewer highly qualified and experienced staff replaced by cheaper and less qualified substitutes.
Yeah.
I will save the country money by coming in and trying to run it better than anybody else. Every 5 years, you have to apply again to do it.
Tendering and monitoring contracts is expensive. Private companies will try and milk the system wherever possible by providing minimum care at lowest cost, but also overcharging and defrauding the taxpayer. Hitting the reset button every 5 years will become a race to the bottom, awarding contracts to the lowest bidder.
Look, we don't make any money by doing it at all, and I'd love to there's thousands of opportunity in the world.
Since 2010, Virgin have been quietly awarded over £2 billion worth of NHS contracts hiding behind the NHS logo. Virgin do their best to avoid paying tax on profits, taxes that should go to pay for NHS and other public services. Let's look again at Branson's body language whilst he tells us he does not make any money out of the NHS.
Look, we don't make any money by doing it at all, and I'd love to there's thousands of opportunity in the world. I think that Virgin Care, the team of people who work for Virgin Care, they're doing everything they can to, improve the service, and they're saving the country money, and it's still a free service.
So we are supposed to believe Virgin Care is doing this for the public good. Virgin Care recently got awarded £328,000 settlement after suing the NHS over a contract. Squandering taxpayers' money that should have gone on patient care in this way would have been avoided if the NHS was not being privatised.
How can we put doctors and nurses back in control rather than having this sort of big wad of middle management that feels like it's bloating it?
And I like to think that's... I like to think that if you go into any of the small little units that we've got,
yes,
that's how we run them. And the feedback we get from our staff is, I think, generally very positive.
Good point, Russell, but Branson doesn't answer the question. He tries hard to underplay the extent of Virgin Care's involvement in the NHS. Doctors and nurses working for private firms will have to put profit first, not patient care. Managers will dictate how care is provided. In Croydon, Virgin Care allowed unqualified receptionists to decide which patients get seen first, leading to tragedy.
And look, there are people who would believe that most companies should be run by governments, and the Labour Party thinks that most businesses should be run by governments. I don't agree with this.
Healthcare is a right, not suited to be run for profit. Commercial imperative is always to maximise profit for shareholders, not quality of patient care. That is secondary. As we have seen over recent years, deliberate defunding and reorganisation of the NHS has had dire consequences. 120,000 excess deaths, overstretched services, hospital closures, crisis of staff morale and public dissatisfaction are just some of the disastrous impacts.
British Rail was owned by the government. They were dreadful, dreadful. And now, the public have got Virgin Atlantic, to keep British Airways honest.
The public have Virgin Atlantic to keep British Airways honest?
And I think we've improved them because they've got competition. It means the public benefit from it. And I think this applies should apply to pretty well every single business. Government should stay out of business, and they should be managing the country much better than most governments do, and not running businesses.
No, it's an interesting point.
Competition does not work in healthcare. Patients are not consumers able to exercise choice. The interaction between doctor and patient in the NHS is based on trust and not money. The profit motive can create perverse incentives for insurers to deny care and for private providers to overclaim and overtreat patients, all to push up profits. If you get run over by a car, you're not in any state to be choosing which ambulance, which hospital or which doctor to treat you. You want the best care delivered quickly by competent staff. Branson has the brass neck to say government can't run things, yet he receives millions in public subsidies to run services. We have the most expensive and worst performing rail system compared to government-run systems in Europe. Virgin Trains have just lost East Coast train franchise and the taxpayer is facing yet another bailout. In 2014, Northern Rail and Virgin handed over £100 million to shareholders. That same year, train operators received £4 billion in taxpayer subsidy.
The NHS isn't a business. It's caring for people, and I guess
but everything's caring for people. I mean,
But I guess that's the thing that frightens me, because if a train is late, a train's late. But if parts of the NHS don't work, that means our loved ones die. It's so dear to us, the NHS. One of the few things we can be proud of in this country.
The thing that makes it so special, you know, anybody in this room who gets seriously ill, the best place they're going to go to get a major operation is the NHS.
Yeah.
Notice Branson is saying major operations will be provided by the NHS. He means leaving the complicated, expensive and unprofitable care with the NHS and for the profitable, easy work for Virgin Care and others. Thank you very much. Vital A&E services are being closed or are under threat across the country. Some are being downgraded and handed over to private companies. Such cuts and closures remove access to emergency care. People will have to travel greater distances during emergencies when every minute counts in life-threatening situations, and this will cause avoidable death and suffering.
Yeah. And so we've got to keep the NHS free forever. Make sure that it's run as well as we can forever. And keep improving it. You know, whatever's the best way.
That's an interesting point, yeah.
Very interesting. The NHS is being starved of cash to create a private insurance market. We have seen a big rise of people paying out of pocket for care because of NHS delays. As confidence in the NHS is eroded further, more people will opt for private insurance. This is the same trick they pulled before privatising British Rail. Vitality, a company partnered with Virgin, have conducted a multi-million-pound advertising campaign. Why would people take out insurance if the NHS is free forever, Richard? Do you know something you're not telling us? If Branson believed in the NHS, he would not be profiting from its carve-up and would not be using offshore tax havens to avoid paying taxes which pay for our public services. To save the NHS, we need to get Virgin and other profiteers out of it as soon as possible. Don't fall for their private sector efficiency PR spin. Please like, share and comment on this post. Support our film The Great NHS Heist and help us keep you informed. Russell, if you're watching, please get me on your show to explain what is really happening to our NHS. Thank you.
You're clearly a very righteous, honourable guy.